All right, now this morning we're talking about that breakthrough cancer pill, Promise. Researchers say it can be a real game changer for patients. It's to treat pancreatic cancer, one of the toughest to catch early because there often are not early warning signs. WECT's Raina Crooms is here now with what the drug does and why doctors are so excited about it. Good morning.
Yes, good morning, Bill. It's called daraxonrasib, and it's the kind of development that patients and doctors have been waiting on because it goes after a gene mutation that helps pancreatic cancer grow. The study was done on advanced pancreatic cancer patients who weren't having success with other treatments. Now, these patients took the drug as a daily pill, and researchers say the patients on the medication lived about 13 months compared to those on chemotherapy who lived for about 7 months. And while that may not seem like a lot, experts say it is the first drug to show a substantial advantage over traditional treatments. The FDA says it does plan to expedite its review and plan to allow for expanded access for some patients who do meet the criteria. And the bottom line is researchers say this could open the door for more trials and more targeted treatments, not just for pancreatic cancer, but for potentially other cancers too. And Bill, there is a big need for more treatment. In 2026, the American Cancer Society estimates that more than 67,000 people will be diagnosed and nearly 53,000 of them will die from pancreatic cancer. That's roughly 2,000 here in North Carolina.
Yeah, I know this firsthand. I had a friend that died of pancreatic cancer, had no symptoms at all, went to the doctor, found out, and died with just a couple of months. Raina, thank you very much.